Good evening, ladies and gentlemen. Welcome to this special session for the Epidemiology and Public Health Sciences track. The special session is called Race-Based Data, Challenges and Opportunities for HIV Research, Policy and Practice. We welcome you all and thank you for coming. So we're going to get started. We are already a few minutes behind, so we'll get right into the thick of things. Just so you have a sense of what we're doing here, we do all acknowledge that race-based data is important and it offers us an opportunity to identify and understand disparities in HIV care, which are due to systemic barriers and the effects of colonialism. So this panel is about talking about the ways in which we can use race-based data to inform HIV care. So what's going to happen is we're going to have a structured discussion with our excellent panel members here, and these discussions will be structured around 4 questions, and then after that we'll have an opportunity for the members of the audience to ask any questions they have or contribute any ideas that they have. So because there are people who are going to get credits for this session does have learning objectives, and I won't read through them. I'm guessing everybody who has chosen to come to this session has looked at the learning objectives and has come here to learn something about race-based data with regards to HIV care. So we have an excellent panel, which I will be moderating. My name is Lawrence Boagbo. I am a research methodologist at McMaster University and the director of the Biostats unit at St. Joe's. And I am more than honored to be moderating this session with an excellent panel. I will start off with the first of our panel members, Dr. Notisha Masakoi, who is a prominent scholar and advocate at the University of Toronto and director of the Black Health Equity Lab, renowned for her contributions to public health and social justice. With a focus on health equity, Dr. Masakoi's research addresses disparities within marginalized communities, particularly in access to health care and HIV prevention. She's a vocal advocate for diversity and inclusion, leading initiatives to dismantle systemic barriers and promote equitable opportunities. Beyond academia, Dr. Masakoi is deeply engaged in community organizations, leveraging her expertise to advocate for marginalized populations' rights and well-being. Her impactful work has earned her recognition as a leading figure in public health and social advocacy, inspiring positive change and empowerment in her community and beyond. Please give a hand for Dr. Masakoi. Our next panel member is Dr. Hughes Luemba from the University of Ottawa. He's a distinguished faculty member at the University of Ottawa, recognized for his expertise in virology and infectious diseases. With a focus on HIV/AIDS research, Dr. Luemba has made significant contributions to understanding viral pathogenesis, drug resistance, and treatment strategies. His interdisciplinary approach integrates molecular biology, immunology, and epidemiology to advance knowledge in virology and inform public health interventions. Dr. Luemba is actively involved in mentoring students and fostering collaborations within the scientific community. He's committed to translating research findings into actionable strategies for disease prevention and treatment, particularly in underserved populations. Through his leadership and dedication, Dr. Luemba continues to play a pivotal role in advancing scientific understanding and improving health outcomes in the field of virology and infectious diseases. Please give him a hand. Our next panel member is Dr. Abigail Kroc, formerly of the OHTN. Dr. Abigail Kroc is a respected researcher and leader in the field of HIV/AIDS at the Ontario HIV Treatment Network. With a background in epidemiology and public health, Dr. Kroc specializes in health services research, focusing on improving access to care and treatment outcomes for individuals living with HIV. She has led numerous projects aimed at understanding the social determinants of health disparities among marginalized populations affected by HIV. She's committed to fostering community engagement and collaboration to address the complex challenges associated with HIV prevention, care, and support services. Through her innovative research and advocacy efforts, she continues to make significant contributions to advancing HIV care and reducing health inequities in Ontario and beyond. Her dedication to improving the lives of those affected by HIV exemplifies her commitment to public health and social justice. Please give her a hand. Our last panel member is Renee Mashing, who is a community-based researcher and owner of 7 Directions Consulting, specializing in indigenous health research and program development. With extensive experience in community-based research and advocacy, Renee focuses on addressing health disparities and promoting wellness among indigenous communities in Canada. She has contributed significantly to the development of culturally appropriate health interventions, particularly in areas such as HIV prevention, mental health, substance use, and sexual health education. Renee is committed to centering indigenous knowledge and values in her work, advocating for indigenous-led research initiatives and programs that empower indigenous peoples. Through her role at 7 Directions Consulting, Renee continues to collaborate with indigenous communities, organizations, and stakeholders to create meaningful and sustainable solutions to health challenges, ultimately striving to advance indigenous health equity and self-determination. Please give her a hand. So we will get right into it, and the first question which we would like to talk about is, how can race-based data inform policy, programs, and services for people living with HIV? Dear colleagues, you have the floor.
We're going to go this way, huh?
Do you want to go first?
Sure, I can go first. My mic's on, everybody
Yeah.
hear me? Okay. So I think that when I looked at this question, it really struck me, and I have had my own experience being migrating to Canada from the United States, where race-based data has been collected routinely for a long time. But because we haven't been doing that here, I think there's a real opportunity to think in a more transformative way, not to just talk about collection, but to talk about action, because collection without action isn't going to get us anywhere. And at the same time, to acknowledge that race-based data collection has been used for the implementation of racist policies. Mm-hmm. It's not by default that the collection of race-based data is going to be an element to transform our society. In the United States, for hundreds of years, race-based data has been collected and used for things like redlining. It was used as part of Japanese internment. There's many ways where that data has been used to harm communities. So I think when we're starting off to talk about collection, we have to set it up in a way that we're sure that that collection is not going to cause harm to the communities that we're trying to serve. And that's the point. We have to build off of that point from the very beginning.
Wonderful. Thank you, Dr. Kirk.
Yes, maybe I can jump on what Abigail started already. Yes, collecting race-based data is very important. Here, in the context of Canada, we've seen in the latest report from Public Health, some of the minority groups are still behind, and we're not really meeting the commitment for finding those who are infected in those groups. What's going on in the prairies, what's going on in black community, and what's going on in other minorities, vulnerable people. We need to know how to approach those people, which policy we need to put in place, what are the programs in order to improve the first 1990 goal that we had for controlling HIV in Canada.
Thanks, you. Renee?
Well, I think in the context of thinking about policy and programming and particularly how race-based data collection can help support people who are living positive, it's visibility. It's about being counted, being important, being relevant. It's in the work that I've been able to be a part of, it's one of the first questions that we get asked if we're seeking support, developing new programs. Who is this going to serve? Where is there a need? Why would we bother to serve this community or that community, this race or that race? And so I think it's a critical foundation for building a rationale for the services that we want to provide, for the need for policy. In the absence of race-based data, you try to explain why a policy is or isn't working in a particular context. So I think that it's a critical building block to create a foundation for the advocacy work that we want to do.
I agree with all of my colleagues on the panel, so I'll just add to what people are saying. I think it's really important to understand that the collection of race-based data for Black community is about providing us with another tool to address the discrimination and the anti-Black racism that we're experiencing in the system. But the collection of data alone is not sufficient if we don't have the ability to govern that data and if we don't have access to the data that's being collected. So those two things have to be in place. The governance has to be in the hands of people who are asking and lobbying for the collection of race-based data. And once it's collected, we need to have full access to that data. And when I say access, it's not just access for us to look at it, it's access in terms of us being able to decide how it's going to be utilized and the interpretation of that data. So all of those things have to be in place. The other thing that tends to not happen in a Canadian context is, okay, we'll collect the data, but we have no intention of developing the remediation plan that needs to go with data when it is showing disparities or disproportionality that a particular community is experiencing.
Wonderful. Thanks for that excellent commentary and discussion. I'm also going to add that while we're talking about race-based data, it's important for us to bear in mind that within healthcare, the ideal purpose of collecting race-based data is to identify people who are experiencing racism and therefore may have worse outcomes than the others. And therefore, under no circumstances should race-based data be merged with other administrative data that can be used to cause harm to those who are experiencing racism. For example, race-based data from healthcare should never be mixed with policing data, right? They should always stay separate. So with that, we will move on to the next question. I hope you're getting a sense of how this session is going to be, and this is exactly what you signed up for, because this is what the discussions will be, and at the end, obviously, people may have great ideas to share as well, so you'll be more than welcome to step up and ask questions or contribute your own knowledge. So the second question is, what are the challenges in identifying and categorizing race?
I think that building on what you just said, Lawrence, it deserves to be said again that the collection of race is about racism. That race is not biological, it is a social construct. There's more diversity, genetic diversity within Africa than between any other two populations in the world. And so to believe that any health outcomes that you see differ by race is due to some biological cause is an incorrect interpretation. And so that has actually caused quite a lot of harm. When we see research that's been done, that now I think we're using the term medical racism, where it has actually affected people's access to care. And when I teach my students, I tell them that when you're doing this kind of analysis as an epidemiologist, we just say, oh, this is just descriptive. We just put this table in. But then that table is used to implement policies and algorithms, and those algorithms have systemically denied Black people health care. So if we look at, there's just a long number of things like vaginal births after cesarean, access to kidney care, access to pulmonary care. And so without setting the context from the beginning, then we actually can cause harm. So starting off by saying that race is actually a social construct and the study of race is the study of racism. And without that context, then I think we should actually move no further. So the other pieces around it are really around what is race. So race differs in different social context, but we need standardized categories. Who gets to develop those categories? Who gets to decide what categories people are in? And those are still kind of ongoing questions in our culture and in our society. And the other issues are really around once we actually have categories, how do we combine categories? We have small numbers issues, so what categories combine together? When I've done this work in the past, you see things like basically an erasure of people. When you combine and you have an entire category of East and Southeast Asian, Chinese people and Filipino people have very different health outcomes. But when you combine them together, you actually erase the experiences of those people who are suffering the worst health outcomes. So there's challenges along the way from the design, the contextual understanding, the design of the collection, but also at the analysis stage. And often the analysis is done in a closed room by a single individual who's deciding how those boxes are combined without the input of the people who actually are represented by that data.
Wonderful, thanks for that. You?
Okay, maybe I can follow up what Abigail started. One of the challenges, what I see as a primary care physician or HIV care physician, is when we are trying to do testing for people coming into the clinic who are not known for HIV, who never had any tests done before. There is a form, but we need to fill up. There is a public health form, but where we need to characterize the person who is doing the test, what is the sex orientation, what is the ethnicity of a person, and not all physicians are doing it. Mm-hmm. And I've seen that firsthand in my clinic and in other clinics at the hospital. I have, so we even asked some of the physicians. I did a presentation a couple of weeks ago on this issue, and many physicians have never seen the form, the public health form, mm-hmm. but we need to use to request the test. If a physician doesn't use that form, just only use the form for the lab, for just HIV serology, the only thing he will write is HIV serology test, but no other form accompanying that lab form in order to identify the race. We will never know how many black people have been infected, how many indigenous people have been infected, how many Asian people have been infected in Canada every year. And in some of the provinces as well, this data is not collected. So you have different variation from province to province. So that's why we try to make the case again this time to improve the data that we're collecting for HIV.
Wonderful.
Absolutely. I feel like I'm doing a peer review. Everything has been wonderful, and a little bit to add. And so, I think you're right. I mean, particularly the collection and the reporting and sharing of that data. And from an Indigenous lens, you know, the first, to your point, asking the question about how somebody identifies, not making assumptions based on how somebody appears, if they are or not Indigenous, thinking about distinctions-based approaches and the ways that we capture Inuit, First Nation, Métis identities, and being able to report that and share that and understand how that is relevant and so critical to have the opportunity to have access to that data or to gather that data and work with it. And so I think it's really, you know, those challenges that you've already so elegantly discussed. I just echo that and say there's such a need to ask the question and respect the importance and value of that.
Yeah, I agree. I find this an interesting question because when people want to discriminate or marginalize or exclude, they have no challenges identifying, categorizing race. But when we want to document that experience, then all of a sudden we have challenges in terms of identifying and categorizing. We have CAHR standards, so data standards in terms of collection of race in healthcare. So we have national standards that have already been established. I think in the HIV field we have to make a decision. Will we adhere to that standard or will we create our own? In Ontario, as a province, we have an anti-racism directorate. Again, we have standards already established for the collection of race-based data. It is collected or supposed to be collected in all sectors with the exception of health because legislatively there are issues with privacy. So we're still pushing our province to collect race-based data in the health field. But the standards exist. We just have to decide that we're going to adopt those standards collectively so that we have consistent collection and identification based on some national standards or provincial standards, which they exist. So this is not an issue if we really have the political will to actually do it.
Wonderful. Lots of knowledge out there. So I would probably add that some of the biggest challenges with identifying and collecting this information is related to conflation of race and ethnicity and also nationality. If you look at the forums, sometimes you're looking at races and then a country pops in, right, which is not directly related to the kind of information that we're looking to capture. But now is the time when we have the opportunity to educate people about these things, educate ourselves, educate healthcare workers, and also prepare material that we can present to people whom we're asking for their race-based data, because they would want to know why you need this information, what you're doing with it, and be sure that it's not going to come back to harm them down the line. So there are also some opportunities there with identifying race. So that said, we'll move on to our third question. We're going pretty fast here, which is good. That'll leave us much more time for discussions at the end. The third question is, what are the challenges and opportunities in collecting race-based data? So the first question was about identifying race, and now the next one is about collecting it. What are the biggest difficulties in actually collecting this information?
Do you want to switch it up?
Do you want to start this one?
Okay,
Yes,
we'll go the opposite.
let's
Challenges and opportunities in collecting race-based data. I can give two examples. One where we voluntarily were collecting data, and one where the institution was mandated to collect data. There is a big difference. So being mandated to collect the data pushes a different process. But in healthcare, we voluntarily were toying with the idea of collecting race-based data in hospitals, and we had a whole campaign. We ask because we care. Some of you may have seen those posters in our hospitals. You know, some of the feedback from the Black community was, well, care about what? Like, I'm not seeing you care about a whole lot of other things when it comes to my racial identity, and so do I trust this process now in terms of giving you the information? But some of the challenges that really stopped the collection at that hospital level was the person doing the intake and their comfort level with asking questions about race. And when people didn't fill that question out, right, not stopping to say, oh, you've missed something and can you add this information? Or even explaining effectively, why are we collecting racial identity? What is it going to be used for? How is it going to be utilized? All of those things. So challenges in terms of training people to collect the data is very, very key. And we all know that as researchers, right? The quality of the data going in is the quality of the data that we have to analyze at the other end. In the other example that I want to give, it's working with Toronto Police Services, who are mandated to collect race. And I chaired the committee that worked with Toronto Police Services to implement the policy to mandate them to collect race-based data because of the inappropriate levels of poor experiences they had when interacting with Black communities. So all of the challenges that we all hear about were in place, right? The reasons why we can't do this, how do we identify people, et cetera, et cetera, et cetera. It took us 3 years, but going through that entire process with Toronto Police Services, right down to me traveling with a police officer in a car to stop someone to actually look at what happens in the interaction, when is the best time to ask about racial identity, how do you document it, what the system needs to look like to process it, took 3 years. So it's also understanding that it's an opportunity, but we have to be prepared to spend the time to actually develop the processes for it to work effectively, and also to get the buy-in from the system and the institutions that we require to collect this data. With the TPS process, when we actually did get to look at the data, what it did was prove the thing that Black communities were saying they've been experiencing for decades. So we were getting data such as Black people were 20 times more likely to be killed by a Toronto police officer than any other racialized group. It is crucial that we take the time to develop these processes and implement the collection of race-based data. It is the only way that we have the tools as Black people to actually show what the experience looks like that we're having in Canadian systems and to change that system.
Wonderful. Thank you very much.
Yeah, I think exactly, right? That opportunity and ability to visualize and to understand and bring to life. And I think, you know, the ethical considerations around that, and I so appreciated one of your earlier comments, Natisha, just thinking about, you know, I've heard a number of presentations. It's wonderful to be at CAHR and see references to OCAP and Indigenous ethical principles, to hear reflections on you know, as a presenter at a conference or at an event or in all the very, you know, different places that we have the opportunity to speak and share, that we're mindful about how community information is being shared, and if it's our authority, our right to be able to bring that information forward, and how that's done respectfully. That's really, in the years that I've been involved in this work, I was sharing a story earlier of, you know, in the late or probably early 90s, late 80s, talking about the collection of ethnic identifiers, the collection of you know, information that was going to identify the context of HIV within Indigenous communities, and it was a real struggle between you know, colleagues who generally were quite aligned to say, is this information that we'll be able to work with and will be meaningful in terms of representing our community and advocating for our needs, or is this going to become information that will be used against us, again to show how sick we are, again to show all the problems in our communities and all the issues that are happening to us that will continue to hold us down and hold us back, and worse, stigmatize us to say, well, all of, you know, when we talked about a community stepping forward and saying that they were acknowledging cases of HIV in the community, they were seeking to provide care and build services, and then all the communities around them started to refer to them as the AIDS community. So that collection of data, that reporting of data, you know, on one hand was really important to be able to start leveraging services and supports, but it was also really hurtful in terms of how it was understood and interpreted by others around the community. And I think with, you know, with the access and possession of data also comes the need to support the capacity to interpret that data. Right? And so that's often been a challenge in some of the work that I've done as a social scientist. You know, we've brokered these wonderful partnerships, and we've had access, we've had the data turned over to us, and then we've said, well, now, how do you run SPSS, and how do we work with this data? And so, you know, there's so many different layers of opportunities for learning and ways of building partnership and need for connecting, so that when we gather this data, it's handled respectfully and in a way that really is serving our purposes and the principles and values of you know, elevating the quality of care that we're able to provide.
Thank you.
Yeah, but I could add just a few, to go back to the same issue, what I was saying earlier today, the primary care physician not addressing using the form, but there's an issue with knowledge, of knowing that there is a form that I need to fill up is an issue, because many of those physicians are not aware, they're not informed, they don't know that there's a form that does exist that should be filled up when you're requesting a test. When even they know, they're always rushing because of the time. Time is an issue. With most of the physicians, we're rushing because we have no time to take care of everything, and filling up a new form, that takes a lot of time. Going through all the components, the sections of the form, sometimes it takes a lot of time. That's why they're rushing, they're skipping that stage of completing that form. And there's another factor that we can take into account because of the stigma that comes with HIV testing. And so when you also have to request someone, what is the ethnicity of that person? Sometimes some of the physicians hesitating, they don't know, they're shy to ask, and so there's a challenge there. You have a challenge with a provider, but there's also a challenge on the person to whom the question will be asked, how that person will accept to show or to give the ethnicity from. So you have the institution, you have the provider, you have the individual who will be doing the test. All of these are challenges. Then you have a challenge at the lab, as just was said earlier today. It is not mandatory for a physician to complete that test, that form, because it is not mandatory. So they will not be able to complete because the lab will accept the only lab form that you will fill up. We will not fill up the public health form because it is not mandatory.
Thanks you.
As I'm listening to my colleagues, I'm thinking about some words I've heard before about this idea of the right to comfort. And what does it mean to have a right to comfort? How can you do this work if you believe you have a right to feel comfortable? This isn't comfortable. And we have to be able to experience the discomfort, because when you look at the data, it shouldn't feel comfortable. So it's not comfortable to ask the question. It's not comfortable to look at the results. It's not comfortable to communicate it to the community, but it's not comfortable for our brothers and sisters to live in a racist society. So when are we gonna decide that we can stand up and say, I'm gonna experience the discomfort of asking a question, of pushing my colleagues to collect data, of having a conversation, of admitting to the patient, I'm asking you this question because we live in a society where certain people are not afforded the same rights and privileges to a long life expectancy, which should be our fundamental human right. And so when we get down to kind of the nuts and bolts, it's not about just listing categories on a form and checking boxes, but confronting our own true issues in our society for how we can live like this. And when are we going to decide to change it? When, Lawrence?
I wonder. Soon, I promise, soon. Thanks for that, Abby. So reiterating what I'm hearing here, obviously collecting the race-based data is probably a little bit more work, and there are no incentives to do it. And the people who are supposed to do it may not have the necessary skills required. And then on the flip side, there's also no penalty for not capturing that information, which sort of makes it problematic. But the recurring theme I'm getting is people who are giving the data need to trust who they're giving the data to, and the providers need to be skilled enough to build that trust. And this just brings me to reflect on the fact that if you look at the amount of race-based data in research studies, it is always more complete than what we have from administrative data, suggesting that the researchers are doing something right, either in terms of their community engagement or the way they explain the purpose of the study in a consent form, which is probably the sort of thing that should be happening routinely everywhere. People need to understand why their data is being collected and exactly what the services they came for entail. So we definitely do have a lot more work to do, but I think we are on the right path. So we do have one more question, and then after that we will open it to the audience. And our question is, to my panel members, do you have any thoughts about how we can improve completeness, interpretation, and contextualization of race-based data?
I'll jump in and say, I think one of the, community engagement is certainly one of the most critical components of creating that opportunity to, both have, the expectation of our physicians or of the labs or whoever is filling out the forms, but also the opportunity for us to say, to remind each other, to remind the service providers, are you asking this question? Please ask this question. It's important to me that you are asking this question and recording this information about me. And then from that first interaction to the point of, interpreting the data, working with the data, contextualizing the data, that community is involved in that, so that there's an opportunity to contribute, to understand. That's work that we've done with the Public Health Agency, and even before there was a Public Health Agency. And I know that that's work that's being renewed to create opportunities to work together and interpret in the context of HIV and AIDS. What are we learning? What are we seeing? What does it mean? What is slang that's being used in information that we're gathering, and how do we interpret that? And it's made a difference, I think, in terms of the quality of the data that we have had access to over the years. I'm gonna put a plug in for the old epi notes that we used to have way back when, for those of us who have been involved for a little while. Always looking forward to chapter 8, and the first time that we had an epi note that actually broke out First Nation, Métis, Inuit data, and it was very cautious, and there were lots of disclaimers about the mathematics that were involved in very small numbers, and how to be mindful and thoughtful about that. But it was information that we could take to our leadership. And I think, again, you create that full circle of the quality and the value of specific data, of race-based data, of seeing yourself in the data. It starts to feed a cycle of, I want more. I can see how this is important. I can see how this leverages interest and concern and a response from our leadership. It helps to fuel passion to be involved in something and respond to something because I see my people, the people I care about, the community members that we care about reflected in this data in a way that was invisible when it wasn't reported. And even to travel between Canada and the U.S. and so in Canada to see Indigenous data and in the U.S. to see occasionally align with American Indian and recognizing that it was jarring the first time I attended an event and realized we're not being taught, we're not there. Where are we? And so I think that's really an opportunity to improve the quality, to improve certainly to improve the way that the data is interpreted, is to engage with community and make space for that dialogue. It will make everything richer.
Wonderful, thanks. Since we're not going in order, anybody who is ready?
Maybe I can jump in.
You can go in, yeah, sure.
We are attending a conference for the sake of networking and trying to get more information about what's going on in other parts of the country and the project that's being done. But when we go back home after the conference, we need to share with the information what we have got, what we have seen, what we have heard from the conference. So it will be, everybody should be getting along, sharing the information. But yes, there is a need to improve the completeness of getting race-based data. Those who are physicians who are taking care, who are teaching in medical school, they need to share the information to the trainees, to the residents and young physicians. They should know that there is a form they need to fill up. If they've never been informed, they will never do that before when they will be in practice. And when everybody working in public health with policymakers, please diffuse the information and make sure that everybody is aware of the need for getting more of this data.
I think we have to remember that data doesn't exist in a vacuum. As much as I would love to be in a dark room looking at spreadsheets all day, that's not what we're there for. And we have to think not just about community engagement, but who gets access to sit in that room with that spreadsheet? How are we training the next generation of epidemiologists and scientists? When you look at the School of Public Health, you often see the least diversity in the epidemiology class. And I think we do better work, even when we're sitting alone, if we have diverse colleagues that can help us and inform us along the way. So it's just like at every level, not just engaging out to others outside of the system, but making sure that our systems actually move to reflect the people that are impacted by the health outcomes that we're looking at. So if we only think about data without thinking about transforming systems, I think we kind of miss that connection to say, how do we move the data to action? How do we move the data to have the policymakers in place that will make the changes, or the researchers in place that will contextualize it for us?
I think one of the things that we want to think about is the completeness. The completeness has always been a problem. We saw some data presented this morning on the 95, 95, 95, and when we looked at the ACB box, it was a big question mark. We can't settle for that. We just have to say we're not accepting those empty boxes in terms of not knowing very crucial information about our community that is absolutely needed for us to address HIV and the disproportionate impacts that it's having on our communities. Nova Scotia PEI is now looking at attaching race to health cards. So why aren't we thinking about those kinds of strategies across the country so that we're not relying on individuals and their inability to have conversations about race? We also want to think about the values that need to be in place when we're thinking about the collection of race-based data. So we have OCAP principles, and adopting or looking at OCAP principles as a guide, we have now EGAP principles for the collection of race-based data in relationship to Black communities. EGAP meaning engagement with the community, governance, access, and protection. We have to think about contextualizing the collection inside of a system that has been quite racist. So how do we guarantee that communities aren't going to be further stigmatized? that we will have control over the data when it is collected. And also looking at researchers who have data currently that could help Black communities understand their experiences. How is it being shared? How is it being utilized? How are we able to access that data? What are some of the relationships that need to be built with communities to ensure that we do have equitable access to data in a system where there are very few of us that are actually in leadership positions or research positions where we're collecting our own data?
Yeah, wonderful. Excellent responses. I'd just like to add that the completeness of race-based data also exists on several levels. If we put in all this effort and we get all the data we want from Ontario, from BC, and then 1 or 2 provinces don't submit race-based data, we still have incomplete data. So we need to work on stimulating that political will to ensure that we can get race-based data from all the provinces and territories and use that at a federal level. And again, I just want to remind us that in terms of contextualizing race-based data itself, the idea behind it is you want to know who is experiencing racism, right? And that's how we interpret that information. There's no value in taking race-based data and using it for some other purpose, because the ultimate goal is to highlight that people are experiencing racism and this is why they have poor outcomes, and here's what we need to do to prevent them from having those poor outcomes. And as a piece of information, the US has now updated how they're collecting their race-based data. And there are two major highlights to this, which will probably not inform how we do things in Canada, but they're still worth thinking about. The first is that for the longest time, they didn't collect information on people from North Africa. So people who were of, I would say, Arab origin. All these people would enter their information as white in the US. And it has been this way for the longest time. So this is a huge chunk of Africa, huge part of the world where most countries are low-income countries, but their data has just been sort of erased, if you would say it that way. And then the next thing is, based on the people in the US, they believe that the general population has not completely grasped the nuances between race and ethnicity. And therefore, they do not collect those as separate entities. They have merged them into one, and they have one variable that captures all of that. So those are advances in the field which are happening, and they will definitely inform the kinds of conversation we're having about what completeness means and how we are interpreting it and how we are contextualizing it. So that's just some information I want to share.
Can I say one more
Yeah,
thing?
absolutely.
I think one of the challenges is also these questions are always check all that apply. And we have like a growing multiracial community and many people who have parents of different origin. And when the way that we do the analysis requires that people be in a single category. And so when you see the form, you see check all that apply, and you say, okay, I'm 3 different races, and you don't necessarily know how that data is going to be used after the fact. And in many settings, it's just combined into a single category that could be multi-race or other or mixed. And in that way, the experiences of those people are kind of all mixed together. And the multiracial category is actually the largest growing racial category, growing very quickly, at least in the United States, where it's routinely collected. And the health outcomes are actually often not very good. But you can't distinguish anything about who those populations are. And so it's very complicated as to figure out like how to develop hierarchies that are meaningful so that people, or informing people when they're checking these boxes, what that actually means when you check more than one box, that it actually could erase your identity in the analysis. And so that's a really important challenge. And as the US is changing their policies, when we look at StatsCan data, it is still based on ideas from the 90s, where we still have visible minority versus not visible minority, and some interesting hierarchies of categorization that aren't necessarily normally understood and actually don't align with the CAHR guidelines. And so we're kind of always in this make it work situation because we don't have things that are in a standardized way so we can all decide. So even in the Ontario Directorate where they have the categories, they actually don't inform on how categories should be combined because they say, well, it's situation specific. But situation specific means that we're all doing something in a different way. So that would be an ideal thing. To improve it would be to have more guidance on the analysis that's guided by community on how categories should be created.
So this is why I wanted you on the panel. So we've come to the official end of the formal questions we wanted to go through. So except if any of the panel members wants to add something.
You can also ask if you can ask in French. I will address in French as well.
Absolutely. Thank you, Hugh. So if there are any questions in French as well, Hugh is willing to take them. But for now, the floor is open for members of the audience to ask their questions.
Yeah, better to have bilingual.
Absolutely. Absolutely.
So many thoughts. Oh my God, thank you. Hi, I'm Adrian Betts, Executive Director, AIDS Committee of Durham Region, and the HYPE program, HIV Youth Peer Engagement Program. I am blessed to work with young people across Ontario living with HIV, most born with HIV. Transitioning to adult care is how the program is designed to have successful transition. Prior to the program existing, 33% of young people transitioning out of pediatric care were lost to care. And those people, those 33% were primarily straight black men, trans kids, and then straight black girls. And so when you go back to question 3, and it's the interpretation of that data, I've been in rooms where the conversation has been, well, what is it about black boys that's making it hard for them to make their appointments and take their medication? Rather than, what is the level of racism being experienced by straight black men, young black men, in the hospital system, the healthcare system? It's crazy how people can take factual information and just turn it around to suit their point of view. When I first moved to the AIDS Committee of Durham, I asked my manager of my support services, what's our Indigenous client percentage like? She was always about 9-10%. And I said, how do we know? I said, well, I'm guessing based on those who've told me. I said, do we not ask? And they said, no. And so I said, well, next client survey, let's ask. And so it turns out we had 24% of our clients were Indigenous or Indigenous heritage, Métis, Inuit, and so forth, First Nations. And then I gathered a group together and said, why did you not disclose? And I said, it's much safer for me to pass as white than disclose my status. And I think when we're talking about the impact of race in information gathering, when there's such tremendous anxiety and fear about how the services people will receive will look based on what race box they check, it leads to people not wanting to play that game, and those who can pass will attempt to pass. And then, I mean, one thing I want to bring back to you too from the youth in my program is the pushback they give me. I am not African, Caribbean, or black. I may be mixed race. My mom may be an African mother. Every African mother in the room knows what that means. And you know, my culture may be Caribbean and spicy and all those things. But when I experience discrimination, it's because I'm black. Not because I'm mixed race, Caribbean, or African. So I'd like you to start referring to me when you capture data as black. So this is thank you.
Thank you. Thank you.
Excellent, excellent. Thank you very much.
Very nice.
Does anybody want to comment on that, or we're happy with?
Oh, I think it was clear.
Okay, wonderful. Thank you. Yes, please.
Hi, good evening, everyone. My name is Tammy Yates Rajadure. My pronouns are she and her. I'm the Executive Director of Racialized. And first and foremost, thank you each so much for being so raw and transparent and open with this panel presentation. So I'm making 2 contributions, and there I think 2 comments. I don't know if the panelists would comment on my comments. So the first is there was a reference, I think Dr. Lawrence, you spoke about in research studies, you know, how much data we're able to to gather it as part of these research studies. And of course, we all know, especially if it's in partnership with an academic body, that we're going through a research ethics board approval. So there are certain layers that are built in to achieve some of those things and the protections and so on. But in your average life, you know, you go to the doctor's office, the doctor has not received research ethics board approval, or, you know, in your everyday life, that environment does not have research ethics board approval. So the safety and the trust, especially for so many of our communities where research, we were subjects of research without our knowledge, without approval, without, you know, so that whole level of trust and fear and the sort of conspiracy theories that we get in our communities sort of embeds that distrust of race-based data being collected. So that's a comment. The other comment is around, and I'm going to refer to a bit of politics and the potential for a transition to a conservative government in time to come. And for many of us who remember some of the previous conservative years when it was not a very friendly race-based data collection environment. And just the fear, so we're having this discussion in the context of almost a polarization of some of our communities, with some, you know, decrying what they call the woke environment, and we're promoting race-based data, but now in an environment that's so divisive, when you even use the word race, you get two camps at the same time. So it's just a comment, and for us to understand that as we move forward with this, that we may be fighting even more than we've had to fight within the last few years, especially if there is a transition.
Thank you. Excellent comment. We do have Abigail who has something to
So
say.
I was actually recently looking at the census data, and I saw 1 year where the count dropped significantly. I think that year was 2006, and that the census information has been used as a political lever. In the United States, the census count was stopped early in 2020, and that led to an undercount of a lot of communities, including Black communities in the U.S. And so making sure that conservative governments and politics don't interfere with the data collection is really important, because we have seen it happen multiple times, and it will likely happen again, so that advocacy has to be there.
And just on a very social level, I'm going to speak directly to you. The level of racism that we're experiencing as Black people in Canadian society is probably at its all-time high. The collection of race-based data is not going to make things any worse. It is bad. It already is bad. The outcomes that we're experiencing now, I mean, if we just take HIV, we can see that the rates of HIV that we are contracting is just going up. The collection of race-based data is a tool to actually interrupt what's happening to us as a people. And so I know there's going to be pushback in terms of people feeling that it's going to further stigmatize us or further marginalize us. But I think we have to understand that I actually don't know sometimes how we are all standing upright as Black people in a very disoriented system, or a system designed to disorient us. So I think it's very important that we ourselves collectively make a decision around what it means to collect race-based data. Why are we collecting it? Why do we need it? And then move together collectively.
Thank you. Winston?
I brought my chair, so I'm not leaving. So I really like how the discussion started, but then it sort of devolved into this thing that looks at race-based data as a technical problem, a technical issue, which it is not. I mean, I think that everybody in this room and all the people who make decisions about data understand the importance of collecting race-based data. So you have to ask, well, what is the real problem? I think that, you know, the real part of the problem, not the only part of it is technical, of course, but part of the problem is that the ownership and control of data is an important element of racial capitalism. So there's no reason why people should give up their control over everybody's data, that, I would be able to access black people's data or the data of people who are X, Y, or Z. So we still live in a world where there is, in fact, lots of race-based data in Canada. I mean, there are challenges, but there's actually a lot of race-based data in Canada. But one of our fundamental problems is that people sit in rooms and make decisions using this data in which black people are absent. Not only absent, but actually forgotten. In other words, people are making decisions about our data and based on our data, and we don't even know sometimes that those data exist. In fact, sometimes you ask a question, somebody would say something, you ask them, how do you know that? Or the data says. Which data? Well, of course they can't tell you because you're not supposed to know. And I think that's where I think the problem really exists, that there's this control, not that there's no race-based data or people don't know how to collect it or don't want to collect it, because when the data exists, what we have is people using it for to advance their own interests. And those interests, in fact, might have nothing to do with us as black people, or with any racialized people, for that matter. So that is what I think maybe it would be helpful, I think, if the panel could respond to how we can get beyond that issue, which is not technical, but which is substantive to how we move forward with not just collecting race-based data, but how we make something meaningful out of this. Thanks.
Winston cannot go unanswered. So I have to say, we definitely have to do more in terms of implementing strategies to improve our ownership of our data and the use of the data that's available. That's definitely one of the things which we have to overcome, because as you mentioned, it doesn't make sense if we're putting all this effort into collecting it, and then when it's collected, we don't have access to it, we don't have control over it, we don't have any governance, and we can't use it as well. So thanks for that, Winston. Yep.
I've been working a lot on some indigenous data stewardship, and one of the colleagues that we work with says a lot, knowledge is power. He says, I don't like your spreadsheets, but I know that knowledge is power, and when we have the knowledge in our hands, then we have power. And I think that data and information is used as power brokerage, and that he who holds the data holds the decision making. And if we knew on this panel how to solve that, I think we would. But it's not just about the collection. It's about examining the power structures and figuring out how to change those power structures. Because it's beyond just saying, well, we collect it, we interpret it, but it's also the what do we do about it. And because we're in this position now, as I said earlier, we don't need to collect health inequities data for 40 years. We could collect it for 5 years and see a change if we connect it to policy and power to actually do some transformative work.
Thanks for that. Renee?
I just want to give a shout out to Claudette Cardinal. I don't think she's in the room, but she's been doing some really fantastic sessions around thinking about the stats talk back, right? And how data is contextualized, how we it kind of marry the numbers with the stories and understanding and give more perspective. And I think that that's also part of the story. Adrian, to your point, we're all going to manipulate the data. We're all going to interpret it and see it through a particular lens. And I think it's, again, it's being really clear and transparent about this is the lens that I'm bringing. This is why I care. This is what's important. And so, to your point, Winston, where is that information? How do we find it? How do we find those rooms where the spreadsheets are all stored? And really, perhaps even a shout out to trainees to say, this is an area that is so important and we need the skills. Certainly within the Indigenous community, it's so exciting to meet young people and allies who are interested in working with Indigenous communities to really be part of that restorying and that working with data in a way that's meaningful. And as much as we're fearful about sharing our data on a form, I mean, how many people check off the privacy and acceptance on all social media platforms that we use? I mean, I've tried to read them. I'm still going to use the platform. So, you know, but there's like imagine if we could partner with Google or Meta and actually, you know, use that big data, that big data mining capacity. There is so much known about us in rooms that we don't have access to, that we don't intentionally share, but or mindfully share, but that can be easily sorted out. So I think there really are amazing opportunities, and we need those brilliant minds to help us to work with that context as well.
Even we have to start rethinking who we give authority to interpret data, right? Who has the authority to interpret data, and whose authority do we listen to, and whose authority do we accept? That is something that I think we as a community have to really sit down and think about as a community of researchers.
Wonderful, thanks. We have one last question.
Kind of segues into my question, actually. Hi, James Pollock from the University of Toronto. I'm a PhD student, and I kind of had a question from a trainee perspective, and I think, Abigail, you sort of touched on this. So a new graduate student joins a lab, and they collect data, and they build a data set, and they view the data, and they see a bunch of variables in front of them. They see age, sex, and they see race, they see ethnicity. And I think many of us that handle this data, we lack the training needed to kind of understand the nuances of all we just discussed today. A lot of these questions, or these variables, they're just variables to us. We can't approach them with the nuances that we discussed here. And furthermore, a fraction of us trainees are able to attend conferences like these, where we're able to attend panels and try to incorporate that into our training. So my question is, I wonder if the panel knows of any resources that are available for trainees and early investigators to learn the skills needed to understand these nuances beyond basic EDI training. And if these don't exist, I wonder how you could envision these skills being incorporated into graduate student and postdoc training.
So I think that if you are an epidemiologist or quantitative researcher, you have to expand beyond and rely on some of the social sciences colleagues as well. And there are many, many books out there that are written to help interpret this. And so expanding your education beyond just what's happening kind of in the numbers and stats. You know, I've been teaching a class at U of T for a while, and I try to talk about this stuff a lot, and a lot of the students are like, well, I'm not doing that kind of work. When I look at my evaluations, well, I'm not doing that kind of work. Why didn't we talk more about study methods? And so it needs to be a core part of the education that anybody who's looking at race data has some understanding of what it means. And I think we see a lot of things go astray when the supervisor or the people who are the stewards of the data don't actually teach the student how to interpret it. And so I think with the OHT and cohort study, we're really fortunate to have a governance committee. And so if you bring something to the governance committee Adrian's on the governance committee. If you bring something to the governance committee and you're interpreting things in an incorrect way, they will let you know. And I have felt like that is the best thing that we've ever provided students, is to have them have that direct feedback from the people in the community who are most affected by HIV. And so how do we build that outside of the systems? The ivory tower is too isolated. And so essentially, if you don't have those resources, then probably you should hold back until you can find them.
Thanks for your question. Talking about the training, I had a medical resident who was doing a training with me. He came to our clinic in order to be exposed to HIV care and do a training. But a young physician will be fully practicing within a few months. Never seen the form, the public health form for race-based data collection. So if I didn't ask the person, the resident will have never seen that before, then will have continued doing the practice without asking the race-based data when she will be practicing. So it's very important for the supervisor to teach, to show, to give information to the person, to the trainee.
Thanks very much.
I'm not sure where the training is, but I also think there's something about remembering the humanity of the numbers you're dealing with, right? That in all of the data, as we talk about, Black people, Indigenous people, this is the, here's the data, here are the stats, to recognize that what's being talked about up there on the screen, or what's being presented, is, you're speaking to a room of people. You don't know who your audience is exactly, but to know that you're talking about my family, you're talking about my cousins, you're talking about my community, and there's an opportunity, and maybe that's a calling out for all of us to make more opportunities to pull people out of the lab and into the community and say, come and see. These are the people whose samples you're dealing with. These are the people whose lives you're counting and reporting back on. And when you when any of us, sit at the front of the room and talk about these are the issues for these people are listening, right? And it's not abstract. This is happening. You're reflecting what's happening in somebody's life, and so to be really mindful and thoughtful about how that's respectfully given back, I think is also important.
Let's connect after this, and I'll share some readings with you. Yes, please. Next question.
Hi, thank you so much for a great panel discussion. My name is Charity, and I'm a master's student at Simon Fraser University. I don't really have a question, but more like comments, and kind of, I think I was agreeing with Natisha when you were talking about how almost like the pros outweigh the cons when it comes to collecting race-based data. And something I was thinking about is, I think policymakers, or people up there in the Oval Office, they're going to make decisions that impact racialized communities whether or not they collect race-based data. Like, we haven't been collecting race-based data all along, but decisions have been made that impact racialized communities anyway. So I think, if anything, collecting this data will give us more ammo as community to be like, okay, this data, we want to use it, and we want to use it this way. So I think the pros, or the benefit that could come from collecting race-based data, far outweighs, some. Of course, I'm not saying the concerns don't matter, in terms of governance and who gets to use that data. I do think that's important, but I think the pros much more outweigh the cons that we think are there. And also, I guess, like, agreeing with Winston in that I don't think it's that hard, or it's not really like a technical issue. Because I think if government wanted to do it, they would. They've got way more money than researchers do. Yet researchers are able to do that much better than they do. So there's a bit of a dissonance there, where researchers with less grant funding are able to do this well. At least a lot of research now is able to do this well, with community advisory boards, with, going back to community, how are we doing this? How should we do it? We're able to do it with much less money than the government has. So they can if they wanted to. So I think we just have to be a bit more, I don't know, not violent is not the word, but a bit more, have a bit more resolve, I guess, in this fight to collect more race-based data, because it has been done. So it is possible, and it's possible to do it in a good way. So I guess I'm just like, to not make excuses for government or policy, because they have the capacity and the capability, and have the people with the knowledge and skill sets to be able to do it in a good way. And my colleague here, Shada, also had a question.
Okay, wonderful. Thank you. We have less than 5 minutes to round up the session, so
I'll
the floor
be
is
quick.
yours.
Thank you, Charity. And Charity said it so much better. But thank you so much for bringing this up. I think something I've struggled with in my data is how to deal with this issue of having multiple categories, and then how do we do our analyses from there, and particularly when it comes up that people have multiple racial identities, which I know, like, in my own data, I fall into the other mixed category. My kid's gonna have 3 ethnicities, and I don't know, like, how we would categorize him. So I'm just wondering if you have any resources or suggestions on best practices to handle data when people do fall into multiracial categories, which I think we're just going to see more and more as our societies become more diverse.
I wish I did. Yeah, I think that I guess what you would want to understand is, before you mix the categories, to be able to look at them each independently. And so when you see, I'm hedging a little bit, because it's also about how you use the data afterwards. Because if you categorize it in a different way than, say, StatsCan does, or other surveys, then it makes it harder for you to compare between your study and other studies. But ideally, we would say like, okay, I look at the data, I see these different outcomes in these groups. I won't combine those groups. I'll combine it in a different way. So before you do the combination, to look at each of them individually and see, like, I mean, meaning when I say each of them individually, each of the combinations individually, and so that then you can see like, okay, this actually aligns with this other category in a more like based on the outcomes that I'm seeing.
Yeah, that makes sense. Thank you.
Do you think we could add a line that says which one do you most identify with?
I think that we should.
Like some way to say,
I think that we should.
I am multiracial, but this is the identity that is particularly how I am in the, like how I walk in the world.
And one of the challenges is also when people check other, how like, you know, when I did surveys in communities in California, and a lot of young people would check other, you have a Latino category, but they would other and Mexican, because they didn't know what Latino meant. Yeah. And so then as you as a researcher, do you have the right to recategorize that person when they've said, I'm not Latino, I'm Mexican?
Yes.
And so then, but do you lose their information when you don't do the categories? Yes. I mean, it's an ethical conundrum. Like, there's no answer to it. I think the key thing is that if you're doing a study, that you have people, a community advisory board, or some people to talk to who represent the community that you're working in, and that you can go and ask them these questions. Because, like, none of us can answer those questions for whatever community that you're working with.
What's been useful, particularly with the OCS data through the OHTN, is sitting down, especially when you're using secondary data where the race has been designed based on their data collection tools, is to really sit down with the institution to figure out exactly how they categorized each one of those cells, so that it's very clear to you what their process was. And that I know when I'm working with this set of data and this institution, I'm using their process. I wish it was standardized across all institutions, but it's not. So it's very important to be very clear in terms of even each researcher, each institution, how they are filling those cells when it comes to race.
Yeah. I have some ideas, but I'll let Professor Itoa ask her question.
I'll be brief. I know we finished your 5 minutes already. So thank you.
28 seconds.
Oh, okay. Thank you for such an insightful discussion. I've enjoyed every part of this. This is something we've been waiting for. And so my question is, so what is the next step, Lawrence and team, after this kind of national dialogue? My second question is there somebody already working on something? Because I would love a collaboration. I currently lead a SHEC-funded grant for data governance for ACB community, and that's a national project. Some of you there are on that team, and I would love for us to collaborate because we have a project already happening for governance.
Thank you, and absolutely, yes. What I can tell you right now is I did a presentation on this morning, but PHAC has collaborated with Black scholars to develop a Black expert working group. And we are working on advising PHAC on how to interpret data collected on ethnic minorities, especially Black people, and also on how to categorize that information. Parallel to the Black expert working group, there's also an Indigenous expert working group as well.
Yes.
So both are working parallel, and we will come up with recommendations for the provinces on how they should capture this data and how it should be shared. And we'll also come up with scripts that health workers can use to approach patients and ask them for their race-based data. So it's a 2-year project, and we are still close to the end of the first year. So there are a lot of things in the works, but definitely there are several opportunities for collaboration which we can exploit.
Excellent. Okay, I'll follow up with you, Lawrence. Thank you.
Wonderful. Thank you. Ladies and gentlemen, thank you all for joining this session, and thanks for the excellent comments and questions and for your close attention. I would also like us to once again thank our panel for their excellent contributions. Please give them a hand. And I would like to close the session. Thank you all very much. Good evening.